What do medical coders actually do? If you are new to this field or you're just curious, today I'm going to break down what exactly a medical coder does day by day, why it matters and so much in healthcare, and what are some of the skills that you are going to need if you're thinking about becoming a medical coder. If you're new here, hey, I'm Victoria. I'm a medical coder, auditor, educator, and content creator. And on my channel, I provide tips, tricks, and tutorials to help you be successful in a medical coding career. Let's get into what do medical coders do? So, at its simplest, a medical coder takes a healthcare service, the records of the service, the record of the doctor's visit or the surgery or the lab test or the study that was performed, and they translate it into universal codes. Diagnoses are coded using ICD-10-CM, procedures are coded using CPT or current procedural terminology, or we use ICD-10 PCS if it's an inpatient service. And we use what we call HCPCS or healthcare procedural coding services for services that are not defined in CPT or things like drugs or medical equipment. And all of these different code sets that we use serve some pretty huge purposes. First and foremost, we think about medical billing. So they tell insurance companies what happened so that providers can get paid for those services, and also helps us support things like medical necessity. If you see a patient had open heart surgery, you would want to see diagnoses that are related to heart conditions. If you're doing a study of the patient's arm, you would want to see that there was some kind of issue going on with the arm. So it helps insurances go, oh, yeah, they had an x ray of the arm and they had pain in their arm. Like that kind of matches up. And they can program systems to help kind of filter through some of those claims. Medical billing and medical coding are kind of like two sides to the same coin, but medical coding serves other purposes. It also helps provide data for things like public health, public research. If we see that a certain patient population has less occurrences of getting certain diseases or more occurrences, like if there's certain areas where we go, wow, there seems to be a lot of lung cancer in this area, that helps us in doing research. Or if we see patients, okay, we have patients that have lung cancer and they had X, Y, and Z treatments and they were able to recuperate, we can research and do a lot more of tracking of that data with using unified codes versus all kinds of text-based narratives. And the codes actually help ensure compliance with federal and payer regulations. They do actually require us to use these code sets through the government. So coders really aren't just like punching numbers. In fact, people sometimes ask me like, how fast do I need to type to be a medical coder? You're not going to be typing in medical codes at such a rapid pace that your words per minute are going to make much of a difference. It's just really that translation process, applying guidelines, and making sure that that healthcare system is running smoothly behind the scenes. So what does a typical like day in the life of a medical coder look like? Obviously, everyone's is going to look slightly different, but let's kind of walk through typical day. You're going to log into your system. Usually if you're working remotely, you're going to log into some kind of server or secure VPN, and then you're going to from there get into your electronic health record application system. You're going to pull up patient charts. They have what are called work queues. So it'll be like, hey, here's all the stuff that was coded by cardiology, and it'll have all of the records, medical record numbers, and all of the encounter numbers. And sometimes the providers will select the approximate codes. Sometimes they will just put in what they call a dummy code. So it might just say office visit. And you have to figure out, was this a 99214? Was this a 99213? What were the diagnoses? And you figure that out by reviewing the documentation. So going through that record of what was documented, the history of the exam, diagnoses, treatments, surgical notes, could be physical therapy notes, whatever pertains to what we are trying to quantify the codes with and potentially bill out. So you're going to look through all of that and assign the ICD-10-CM codes, CPT codes, sometimes HCPCS code. If you're doing inpatient, you're going to look through that whole inpatient stay from admit to discharge, and you're going to code the ICD-10 PCS codes. You're going to figure out DRGs. So there's different types of medical coding, and certain ones you might work with certain code sets and others you work with more code sets. So then typically what you'll do is you take all of those codes that you've researched and you're like, this is the one. It goes into that billing system so it can get out the door and submitted to insurance. But it's not just like one or two charts. Depending on the type of coding you're doing, you might code a handful of charts if you're doing that whole inpatient stay, because sometimes patients are in the hospital for 10, 15 days, and it could be a long chart. But it could also be office visits. I mean, look how quickly some of those family doctors or urgent cares are seeing patients in a day, tons and tons and tons of them. So you might just be pounding out charts. It really depends on how many, as far as the setting, what type of coding you're doing, what systems you're working in, what kind of records you're having to pull. So I can't really quantify like it's going to be X amount of records an hour, or this is how many codes you have to pull in an hour. It really depends. But regardless, accuracy is definitely going to be key across the board, because the wrong code can mean denials, it can mean compliance issues, legal risk for the provider. There's cases where you might think you're a great coder because you're coding everything out and everyone tells you, oh, great, you're getting all these out and they're out the door and everything's wonderful. And then you hear from compliance and maybe you didn't know what you were doing and things were not right. And there's even lots of instances where providers will code things for years and then something hits the radar of an insurance company or of Medicare and they wind up having to pay back tons and tons of money because of things like they didn't understand the coding rules. They found out they were submitting bills and the medical record didn't match up to what was billed out. They couldn't find the medical records to prove they even did those services. So there's a lot of things that can go wrong. But coders aren't all in one place. You could find medical coders in hospitals and physician offices, outpatient clinics, labs, insurance companies, and then increasingly, of course, working from home. Some coders specialize in inpatient hospital coding, which uses ICD-10 PCS. Others focus on Profi coding. Some of them do what they call risk adjustment, which just deals with diagnosis coding. And then there's things that are kind of coding related, like tumor registry, where they like people who have coding experience, but it's not quite the same as doing medical coding. It's a different type of training. Now, medical coding isn't all about trying to remember codes or memorizing codes or knowing how to apply the guidelines. There's also other things that are important in being a successful medical coder. So things like attention to detail. Every word in a medical record matters. And even the absence of certain words. So you have to have that critical thinking and go, okay, I see what the doctor documented they did, but I don't know if that's actually what was performed. It sounds like maybe they missed a word that changes kind of the context of this and also changes the codes then based off of that. So sometimes you need to communicate with those providers. You have to query them for for clarification. Send them emails and go, hey, I'm looking at the record. It says this. I'm thinking it might be this, or this. What do you think? And then chasing them down to also addend the medical record and go, yeah, I know. Okay, so you need to fix the medical record and add on a clarifying statement. And medical coders need to be adaptable because the codes and the regulations change frequently. The codes change every year and you're always learning and there's a lot of opportunities to grow too. You can do really well in this field if you want to really specialize and have some good career strategies. And really those soft skills, things like problem solving and precise communication, uh, that is what really helps coders move into those higher paying advanced roles like auditing and compliance and education. But why does it matter? Well, because without coders, healthcare kind of stops. If services aren't coded, they can't be put on that claim form, billed out, and that means providers don't get paid. So patients get frustrated with bills and the data we use for everything from tracking diseases to outbreaks to policy settings. Like that's it all comes into play in medical coding. So while coders are kind of behind the scenes, the work is really essential. It's one of those careers where you don't really see the impact until something bad happens and you're like, oh, yeah. Every time everything else is running smooth, that's when things are going really well. So, what do medical coders do? We take complex medical stories and translate them into universal codes that keep the healthcare system running. If you want to find out more, there are tons and tons of other videos on this channel about medical coding, getting into careers, school recommendations. But if you found this helpful, don't forget to like, share, and subscribe because you're going to want to know all about the alerts that are going to pop up when I have all kinds of new videos, like how to get through your training, like how to prepare for those certification exams, because medical coding, you have to get a certification from either AAPC or AHIMA. I talk about that more in other videos. Don't forget to like, share, and subscribe. I will see you guys in the next video. And until then, just keep on coding on.